Autism, be aware, be understanding. Outline the history of ASD. What is ASD? The reasons of ASD. ASD symptoms, ASD treatment, helping children with ASD. The history of autism. From the early 90s, autism has referred to a range of neuropsychological conditions. What is autism? Autism is an umbrella term for autism spectrum disorder, which is characterized by constant problems with social communication and interaction across a variety of contexts. Early onset emergence of symptoms, typically in the first 2 years of life, repetitive restricted patterns of behavior, activities, and interests. Symptoms that cause major impairment in social, educational, or other important areas of functioning. It is called a spectrum because of the wide range of symptoms and impairment levels children can have. Some are only mildly affected by their symptoms, while other children are severely disabled. Autism, a brief timeline. 1911. Swiss psychiatrist Eugen Bleuler first uses the term in reference to certain symptoms of schizophrenia in 1920s, stemming from the belief that autism symptoms are caused by diet, including those high in gluten. Biochemical treatments are used, and diet supplements and restrictions are put in place for children with autism. 1930s. Electroconvulsive therapy is first used to try to correct antisocial and self-destructive behavior. Though controversial, this type of treatment is still used in rare cases today. 1940s. Autism is first used to describe children who experience emotional or social issues. 1943. A definition for autism is put in place by child psychiatrist Leo Kanner. He describes autism as lack of affective contact, fascination with object, desire for the same, and non-communicative language before 30 months of age. 1944, German psychiatrist Hans Asperger detects a condition with similar affliction that is now called Asperger syndrome. There is still believed to be a link between autism and schizophrenia. 1950s, autism is falsely suspected of being caused by cold and uncaring mothers. Parentectomy or removal of the afflicted child from his or her parents for long period of time is utilized for treatment by a doctor in a study. 1960s, various treatments are tested, but there is still a limited understanding of what helps patients. Pain and punishment are still inflicted on children. To try to correct antisocial behavior, the use of LSD is implemented as a serotonin inhibitor. It is believed that altering the patient's state of perception will help alleviate symptoms. 1965, Bernard Rimland, an American psychologist, establishes the Autism Society of America, one of the first autism advocacy groups. 1980s, early forms of behavioral therapy are used primarily in the treatment of children with autism. 1990s, holding therapy, in which a child is restrained and forced to perform various social reactions like maintaining eye contact, is used. Today, the term autism spectrum disorder is used and specific tools for diagnosis, the severity of a child case are developed. Applied behavioral therapy and psychodynamic therapies are typically used to treat children with autism. One in, 1 in 10 number of children with autism who also have Down syndrome or another chromosomal disorder. Unfortunately, along with a more thorough understanding of autism has came a boom of diagnosis and fear regarding the cause of the disorder. 2 years, age at which a diagnosis of autism is typically reliable. Most children are not diagnosed until they are 4 years old. 120% increase in autism spectrum disorder prevalence between 2003 and 2010. Okay. Due to a more thorough understanding of the disorder and effective treatment for its symptoms, more children are getting the help they need to live more social, emotionally fulfilling lives. We now understand a lot more about the disorder and who it affects. The basis of ASD. Genetic factor. may be the most significant cause of ASD spectrum disorders. Early studies of twin had estimated heritability to be over 90%, meaning that genetics explains over 90% of whether a child will develop ASD. A common hypothesis is that ASD is caused by the interaction of a genetic predisposition and an early environmental insult. Several theories based on environmental factors have been proposed to address the remaining risk. Epigenetic. Epigenetic mechanism may increase the risk of ASD. Epigenetic changes occur as a result not of DNA sequence changes but of chromosomal histone modification of the DNA basis. Fourth is prenatal environment. The risk of ASD is associated with several prenatal risk factors, including advanced age in either parent, diabetes, bleeding, and use of psychiatric drugs in the mother during pregnancy. Fifth is infectious process. Prenatal viral infection has been called the principal non-genetic cause of ASD. Prenatal exposure of rubella or cytomygelovirus activates the mother's immune response and greatly increases the risk for ASD. Symptoms of ASD. Main disabilities. The signs and symptoms of autism spectrum disorder vary widely, as do its effects. Some autistic children have only mild impairments, while others have more obstacles to overcome. However, every child on the autism spectrum has problems at least to some degree in the following three areas. First, communicating verbally and non-verbally. Second is relating to others and the world around them. Third is thinking and behaving flexibly. Fourth is some children with autism spectrum disorder start to develop communication skills and then regress. Usually between 12 and 24 months, this should be taken very seriously as regression is the major red flag for autism. How to diagnose autism? Monitor your child's development. Autism spectrum disorder involves a variety of developmental delays, that is social, emotional, and cognitive. Take action if you are concerned. Every child develops at a different pace, but if your child is not meeting the milestones for his or her age, or you suspect a problem, share it with your doctor. Don't accept a wait and see approach. Waiting is the worst thing you can do. You risk losing valuable time at an age where your child has the best chance for improvement. Trust your instincts. Sometimes even well-meaning doctors miss red flags or underestimate problems. Listen to your gut if it is telling you something is wrong and be persistent. Early signs of autism in babies and toddlers 0 to 18 months. Inability to tolerate, inability to relate to children or adults, poor speech or lack of speech, inappropriate laughter or crying, oversensitive or undersensitive to sound, inappropriate playing with toys, difficulty dealing with changes in routine, oversensitive or undersensitive to touch. The following delays warrant an immediate evaluation by your child's pediatrician. By 6 months, no big smiles or other warm, joyful expressions. By 9 months, no back and forth sharing of sounds, smiles, or other facial expression. By 12 months, lack of response to name. By 12 months, no babbling or baby talk. By 12 months, no back and forth gestures such as pointing, showing, reaching, or waving. By 16 months, no spoken words. By 24 months, no meaningful two-word phrases that don't involve imitating or repeating. Signs and symptoms of social difficulties in autism. Appears disinterested or unaware of other people or what's going on around them. Doesn't know how to connect with others, play, or make friends. Prefers not to be touched, held, or cuddled. Doesn't play pretend games. Engage in group games. Imitate others or use toy in creative ways. Has trouble understanding or talking about feelings. Don't seem to hear when others talk to him or her. Doesn't share interest or achievement with others, drawings or toys. Basic social interaction can be difficult for children with autism spectrum disorders. Many kinds of the autism spectrum seem to prefer to live in their own world, aloof and detached from others. Common self-stimulatory behaviors: hand flapping, rocking back and forth, spinning in a circle, finger flicking, head banging, staring at nights, moving fingers in front of the eyes, clicking light switches on and off, repeating words or noises. Autism spectrum disorder treatment. First is educational intervention and medical management. Educational intervention. Applied behavior analysis, ABA, works to systematically change behavior based on principles of learning derived from behavioral psychology and encourages sorry, and encourages positive behavior as well, teaching new skills. Second is a speech therapy. With a licensed speech language pathologist is important in helping to improve a person's communication skills, allowing better expression. Some individuals with ASD are nonverbal, so the use of gestures and sign language are useful. Third is occupational therapy, OT, used as a treatment for the sensory integration. Issues associated with ASDs improve the individual's quality of life and ability to participate fully in daily activities. Fourth is physical therapy, PT, to improve gross motor skills and handle sensory integration issues, particularly those involving the individual's ability to feel and be aware of his body in space. Medical management. Pharmaceutical treatments can help ameliorate some of the behavioral symptoms of ASD, including irritability and aggression, such as risperidone and aripiprazole. Medication should be prescribed and monitored by a qualified physician. However, medication may have adverse effects. Stem cell therapy is a new effective approach to treating ASD and is based on the unique ability of stem cell to influence metabolism, immune system, and restore damaged cells. Stem cell therapy targets several aspects of cancer. First is immunity, second is metabolism, third is communication ability, fourth is learning capacity, memory, thinking. Improvement is reached through the restoration of the lost, impaired neuron connections and formation of the new neuron connection, speeding up brain reactions through improvement of synaptic transmission and development of the new neuron connection. Improvement in ASD after the stem cell therapy. Better tolerance of different foods and improved digestion, easier contact with the child. First of all, eye contact, more adequate behavior at home and outside, less or no fear of loud noises, strangers and bright colors, gradual improvement, improved verbal skills, writing skill improvement or development, improved self-care skills, improved attention span and concentration. Helping helping children with autism. Don't wait for a diagnosis. As the parent of a child with autism or related developmental delays, the best thing you can do is to start treatment right away. Stick to a schedule. Children with autism tend to do best when they have a highly structured schedule or routine. Reward good behavior. Positive reinforcement can go a long way with children with autism. So make an effort to catch them doing something good. Praise them when they act appropriately or learn a new skill. Being very specific about what behavior they are being praised for. Make time for fun. A child coping with autism is still a kid. For both children with autism and their parents, there needs to be more to life than therapy. Pay attention to your child's sensory sensitivities. Many children with autism are hypersensitive to light, sound, touch, taste, and smell. Figure out what sights, sounds, smells, movement, and tactile sensation trigger your kid's bad or disruptive behavior. Create a home safety zone. Carve out a private space in your home where your children can relax, feel secure, and be safe. So, autism is always unique, totally interesting, sometimes mysterious. Thank you.